All right, so you're getting ready for a podiatrist interview, huh?
That's right. We're going to use RoleCatcher's resources and kind of unpack all that.
Yeah, so you can totally ace it.
Exactly.
We've got a ton of stuff to help,
Yeah.
like sample interview questions
Yeah.
and insights into the career, and even a glimpse at how AI can help.
AI is such a game changer,
It really is, yeah.
So let's dive in. First things first, what does a podiatrist actually do?
Yeah. So many people think it's just bunions and ingrown toenails,
Right.
but it's a lot more than that.
It is way more.
RoleCatcher's What They Do section shows just how diverse it is.
Yeah. It's really fascinating.
Like, it's not just treating those common foot problems. It's biomechanics surgery,
Yeah.
wound care, sports medicine.
Forensics, even.
Yeah,
It's really a crucial role.
it is. And the field is booming, too.
Oh, absolutely.
RoleCatcher says in their industry trends report, there's a projected 11% job growth.
Over the next 10 years?
Yeah.
That's much faster than average.
Wow, 11%. That's incredible. Why such a surge?
Well, a couple of reasons. An aging population means more age-related foot problems.
Well, that makes sense.
Right. And then there's the increase in chronic diseases like diabetes.
Which requires specialized foot care.
Exactly.
And speaking of diabetes, that actually leads perfectly into one of RoleCatcher's sample interview questions.
Okay. Hit me.
Can you describe your experience in working with diabetic patients?
Ooh, that's a big one. They want to see that you understand the unique challenges.
Yeah, because diabetic foot care is a cornerstone of podiatry.
Absolutely. Think about things like diabetic neuropathy, foot ulcers, the importance of preventative care.
It's about more than just treating problems that are already there.
Right. You need to know how to prevent complications later on.
So it's really about that long-term approach.
Exactly. Highlight that knowledge and showcase your approach to things like patient education, wound care.
Collaborating with other healthcare professionals too, right?
Yeah, all of that. And they might even follow up with something like,
Okay, like what?
what are the most important things to consider when developing a treatment plan for a diabetic patient?
Okay, so be ready to talk about a holistic approach, I guess.
One that takes blood sugar control into account, proper footwear.
Wound management, of course.
Right, and empowering patients to take an active role in their own care.
So it's about the whole person, not just the foot.
You got it.
Now, before we get into more questions,
Okay.
let's talk about RoleCatcher's AI tools.
Ooh, yes, their secret weapon.
Right. They can really help you tailor your answers.
Absolutely give you a leg up in the application process.
So how does this AI actually work?
Okay, so imagine you upload your CV in the job description to their platform.
Okay.
Their AI compares the two and highlights any skills from the job description that aren't on your CV.
So it's like it shows you exactly what you need to highlight.
Exactly, or maybe even brush up on before the interview.
And it analyzes your answers to application questions too, right?
Yes, and it'll give you suggestions for improvements based on what the job needs.
It's like having a personal interview coach.
It really is.
Wow, okay, that's super helpful. So back to the sample questions. What's next?
Let's look at this one. It's a pretty common one. Can you explain your experience in diagnosing and treating common foot and ankle conditions, such as plantar fasciitis and Achilles tendonitis?
Okay, seems pretty straightforward. What are they really looking for here, though?
Well, they want to see your clinical knowledge in action.
Not just like reciting textbook definitions, right?
Right. You got to talk about your diagnostic process, how you tell conditions apart.
And the treatment methods you found effective.
Exactly.
Okay, so I should maybe walk them through a scenario like a patient comes in with heel pain, and I have to figure out if it's plantar fasciitis,
Yeah.
Achilles tendonitis, something else entirely.
Yeah, exactly. And then you can discuss your treatment approach.
Showing my expertise in like orthotics, physical therapy.
Or even corticosteroid injections.
Oh, right. What if they throw in a tough follow-up?
Like what?
Like, what are the latest advancements in treating plantar fasciitis?
Oh, that's where you show that you're staying up to date.
Right, like mentioning new therapies or innovative treatments.
Exactly. They want to see that you're on top of things.
It really is important to be on the cutting edge of podiatric care.
Absolutely. Continuous learning is crucial. RoleCatcher actually talks about this a lot in their career stages and continuous learning sections.
Oh, that's good to know. So we've talked about diabetic foot care and common foot conditions. What other kinds of questions might pop up? So we've talked about questions about specific conditions.
Yeah.
But what about questions that are more focused on how you interact with patients?
Oh, yeah. Those are important. They might ask something like, how do you approach patient education and counseling?
So it's not just about knowing the treatment.
No.
You have to explain it in a way that makes sense to the patient.
Exactly. Think about how you'd break down complex info. Do you use visuals or analogies?
Oh, and share examples of how you've helped patients take charge of their own care.
Exactly, like maybe creating personalized exercise plans or helping them adapt their lifestyle.
Right, it sounds like active listening is super important here, too.
It is, you want to really hear their concerns.
Yeah.
And then that could lead to a follow-up question like,
Oh, like what?
how do you handle a patient who is resistant to your recommendations?
So they want to see how you handle conflict,
Yeah.
basically.
And how you adapt your approach.
So instead of getting frustrated, I should try to understand why they're resisting.
Exactly. Find that common ground.
And really emphasize that patient-centered care is the priority.
Always. Now let's switch gears a little bit. They might ask about surgery.
Oh, like, can you describe your experience in performing surgical procedures on the foot and ankle?
Yep.
But not all podiatrists do surgery.
Right.
What if I don't have a ton of surgical experience?
Just be honest about it. But if you do have experience, then this is your time to shine.
Okay.
Highlight the procedures, you're good at your success rates, any special techniques.
So if I'm comfortable with like bunionectomies, I should talk about the specifics of that procedure.
Exactly. And be prepared for follow-ups.
Oh, what kind of follow-ups?
They might ask about complications you've faced during surgery.
Oh, okay.
They want to see how you handle pressure and make those tough decisions.
So just be honest and emphasize patient safety.
Exactly. And talk about what you learned from those challenges.
Right. This is where a RoleCatcher's AI could come in handy.
Oh, absolutely.
Practice your answers, get feedback, and really make sure you're hitting all the right points.
That AI is a lifesaver.
Blah.
Speaking of which, does RoleCatcher talk about different career paths in podiatry?
Yeah, they do. They have these awesome career stages and advancement paths sections.
You can explore specializations like sports podiatrists, pediatrics, wound care.
Even research.
Yep. And knowing about these different paths?
It could help you come up with good questions to ask them.
Exactly. It shows you're thinking ahead.
Right.
Okay, now back to the interview questions. Here's one that almost always comes up. How do you keep up to date with the latest advancements in podiatry?
They want to know that you're a lifelong learner.
Right, because podiatry is constantly changing.
So you got to show them you're staying current. Conferences, journals, online courses, research.
All of that.
But don't just say, I read journals.
Nope.
Mention specific things.
Right, like a study you found interesting or a new technology you're excited about.
And be ready for follow-ups.
Oh, yeah, for sure.
Like, how have you implemented those advancements into your practice?
Exactly. They want to see that you're actually using what you learn.
So if I learned a new technique for orthotic casting, I'd talk about how I incorporated it and how it benefited my patients.
Perfect. You're not just passively learning, you're actively applying that knowledge.
Okay. I feel like we're making good progress here.
I think so, too.
What other questions should we cover?
Okay.
So we've covered a lot of ground.
We have.
But RoleCatcher highlights a few more questions that we should probably hit on.
Okay.
These ones are less about specific conditions and more about you as a podiatrist.
Right. Like, can you describe a time you had to manage a difficult patient or situation?
Those always make me nervous.
I know, right? It feels like a trap.
It does. Like they're trying to get you to say something bad.
They're not trying to trick you. It's really about showing how you handle challenges.
Professionally.
Exactly. So choose an example where you succeeded.
Okay.
Focus on the positive outcome and what you learned.
So like if a patient wasn't following my recommendations, I talk about how I tried to understand their perspective and maybe adjusted how I communicated with them.
Yeah. Show that you can stay calm, adapt, and find solutions.
And RoleCatcher's AI can help with freezing these answers too, right?
For sure. You can test out different ways of saying things and see what the AI thinks.
It's like having a personal editor for your interview.
I know, it's awesome.
Okay, so what other soft skills questions might they ask?
Probably something like, how do you stay organized and manage your workload?
Oh yeah, that's a classic. It's
Right.
all about time management and prioritization.
Exactly. You want to show that you can handle a busy practice.
So should I mention any specific systems or tools they use?
Definitely. Like scheduling software or even just a to-do list.
Be specific about it.
Yeah. It shows that you take organization seriously.
Okay, and what about follow-ups? Like, how do you handle a sudden influx of patients?
Or unexpected emergencies.
Right. They want to know if you can adapt.
And stay calm under pressure.
So basically highlight my problem-solving skills and my ability to prioritize.
Exactly. And maybe give an example of a time you successfully juggled a crazy schedule.
Or dealt with a last-minute patient crisis.
Perfect. And then they might end with a more open-ended question.
Okay, like what?
Something like, What do you believe are the most important qualities for a podiatrist to have?
That's kind of philosophical. What are they getting at there?
They want you to show your passion for podiatry.
And the values that are important to me.
Exactly. Think about what makes you a great podiatrist.
Empathy, good communication skills, dedication to learning.
Right. But don't just list them, bring them to life with examples.
So instead of saying, I'm a good communicator, I might share a story about how I helped a patient understand a complicated procedure.
Perfect. Make it personal and memorable.
Wow, this deep dive has been amazing. We covered so much, from treating foot conditions to career paths and what makes a good podiatrist.
I feel like we gave our listeners a lot to think about.
I think so too. And remember, everyone, RoleCatcher has a ton of resources to help you.
Their AI tools are seriously game-changing.
They really are. So to all our listeners out there getting ready for that podiatrist interview,
Good luck.
you got this. We believe in you.
And don't forget to let us know how it goes.
We want to hear all about it.